Hello guys, welcome back to my channel. I am at 40 Suites and I'm going to see a pediatric orthopedic surgeon. I'm supposed to take my daughter, so I'm suspecting that she has a club foot, and I noticed this on day one of birth, and I actually mentioned it to the nurse, of which they were like, you're just being overcautious. But I wish I actually, I followed my instincts. So we are going to check her leg. So anyway, I'm going to take you with me, and I really want to vlog because a lot of parents experience this, and then children grow up with knock knees, with bow legs, with, all those kinds of deformities. But these are things that can be rectified when noticed early.
My heart rages around like an fire. So many things that I left unsaid.
How are you?
I'm fine, thank you. How are you?
How are you, sir? I'm good. Sit around. Nice. Glad is here. So, that's good. It's not tight, this one.
I've known and worked with Dr. Kakuya for so many years, and I know he's one of the very, very, very good pediatric orthopedic surgeons. So I trust his decision. Nothing is going to be done on baby, and baby is going to be fine at the end of the day. Now, I'm sure that you guys have noticed that Megan's tooth have delayed. We removed the teeth when she was, I think, 6 years. She is now 8 years, and they're yet to grow back. So apparently what happened is that the tooth was extracted earlier than it should have. And I honestly blame the dentist who did that. Here at Horizon Dental Clinic, this is in Umoja. Yako hizi mbili tangu zitolewe hazimeangi. Hii ndo imeanza kumea kidogo, but the problem is hii ingine inaanza kumea the wrong place. See? So imepata kitu inaitwa cyst. Is it painful? Okay, what do you feel about it? Excited. No, what do you usually feel about this, the teeth? The gap.
Excited.
You feel excited about the gap? You like it?
No.
Do you like the gap?
No.
What do you feel about it?
I don't know.
You don't know what you feel about it. Okay. Then another thing is that there's an extension here. This one also. This one that needs to be taken care of, and we will explain why. It's good. Huyu naye ameangaliwa meno, ameangaliwa miguu. Apparently, the legs are okay, very much okay. Me, I was so scared asihitaji surgery, or maybe apatiwe hizi ortho aids. Kuna zile viatu watoto valisho ama wanaekwa plaster.
Kama ya nani?
Ya nani?
Brother Travis.
Brother Travis?
Yeah.
Amoye kwa kitu kwa miguu?
Na alidungwa sindano akaweka plaster. Kama ilikuwa ya Alisha.
Hiyo ni Alisha. So now I was so scared. Yeah, apparently it turns out that she has a flat foot. There's a little bit of an eversion, but not extreme. And the Achilles tendon is not stiff. So we do not need to do anything. However, we were advised to make sure that she walks barefoot most of the time, and if possible to walk barefoot on rough surfaces. I'm going to explain later, but you guys, apparently the shoes that we are wearing can cause us some deformities, and apparently the kids cannot be touched. No, actually the bones, the 19 bones are muscles in the foot. They mature by the age of 5 years. She's just 1 year, 9 months. So she has a lot of time for that to correct itself. And if anything wants to be done, it will wait until she's 13 years. But we are trusting and hopeful that walking barefoot is going to do it. So, the doctor is going to be there. No sweets for now. The doctor is going to be there in like 30 minutes.
After the treat,
And then we realized, okay, this girl is going to undergo a surgery. We are here to see an oromaxillofacial surgeon. So definitely this is going to be a surgery, and she may not be able to eat well after this. Hey, Aki, this girl has gone through it, God. I am praying this is the last serious, okay, it's not so serious, but I really pray this is the last procedure she's going to undergo. This is going to be that surgery for her. So anyway, we want her to eat, and then that will. Tunaenda wapi? Hai, pale hapa kai vizuri yake.
Anasema saidia mbele.
Side ya mbele, huku ni nyuma, huku ni side. So I was telling you, this is Umoja. My sister-in-law is a dentist. She's the one who referred us to this particular oromaxillofacial surgeon. So referrals are very important. Take away, peke yake. Hakuna hata ka hoteli, hakuwezi kosa hoteli.
Inaweza kosa.
tunaweza kuwa na hoteli hapa.
I can almost feel you walking in the distance, but I know that is not reality. If you are echoing around inside these parallel dimensions all alone.
Unataka kuniambia mtu mzima inaweza kosa hoteli? Acha tuulize tu. Hayakwezi kosa hoteli, surely. Sasa tunatafuta ka hoteli around this area.
Hotel ya kukula. Mkienda hivi hii side kuna place resort itaona imetoka ore. Ndio ndio tukone. Unataka hoteli nzuri ama hoteli normal?
Hoteli poa.
Hoteli poa, ebu cross basi tunapitia kwa package.
Oh, hapo sofa.
Kwanza kuna pesa kadhaa.
Okay, asante. So we've been told to get inside the supermarket. That's the only place we can get some decent meal around here. So let's go. Tunaweza pata clean shelf ndo hiyo. Mimi, the business person is just seeing business opportunities because this place is so busy. This place is so busy and yet they don't have hotels. Like how? We walked for like more than 5 minutes. That's a business opportunity. People of Umoja, I think this is Umoja. I have no idea ni Umoja side gani. But come on. My fellow people. Are you feeling me? Like I'm always walking and spotting business opportunity. Yes. What do you want?
Love this.
This one. Chicken.
Two. And
Chicken and
that ice cream. What is that?
at ice cream for dessert.
Yeah, I've never eat ice cream. Not drink ice cream for a whole week. So there
There it is. I want you to look at this yogurt. So they claim it's probiotic yogurt, and there are so many yogurts like this in the market nowadays. And because we all know the importance of probiotics, we are rushing to buy these things. But this is one of those genuine yogurts, and I'm saying this because when you come here and check the ingredient list, you can see the milk. It's not focusing. The milk is not pasteurized. So what I'm trying to say is that most of the time we take a lot of dead yogurt, like dead food. But if you want to buy yogurt and you want to benefit from the bacteria, then you have to check and see if the milk is pasteurized or not.
My heart rages around like an ocean in my head. I can almost feel you walking in the distance, but I know that it's not reality.
The surgeon is so friendly. Imagine she just came. These ones were bought here and gave them balloons. You know? How are you feeling? You're next. How are you feeling?
Boom, 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 but then like exactly my heart is like, but I'm like,
Oh, why are you excited?
I can't go.
Yes?
I can't go.
Finally. But then again, why are you scared? Because you said you're both scared and excited. So why are you scared?
My heart is scared.
It's your heart. Unasikia do.
As to allow them, create a window. Yeah? Create a window or a gate where the teeth can come through. Yeah? A small cast like this to allow the teeth to come. See that there? Mom, someone. Yeah, and put that.
Alicia.
Hi, Alicia. Hi. Right, and then something to go, right? Yeah. So let's smile like open so that you do this.
This one had
like
cavity.
Yeah.
For me.
Yes. 11 years before. That's the cavity. Open. Okay.
That?
Big air.
Yeah, it's usually air.
Yeah. This is air.
Mm-hmm.
Yeah. This is nice. And this is water. If you don't want the water, see. Okay. I want to see if there's a tooth that has a hole right there.
She's 8.
Yeah, she's 8 years.
Mm-hmm.
So these two teeth,
Mm-hmm.
should have been in the mouth already. Okay.
Mm-hmm.
So they have delayed, and we need to find out why. That's why we're doing an X-ray.
Okay.
Yes,
So it's not given because ilikuwa early cavity. Could be so many reasons.
So many reasons. There could be something.
They removed it before I was 8.
Before you,
my father was refusing because it was not shaking that.
It was not shaking and they removed it. Yeah. But usually there are many factors that will block a tooth that is supposed to be in the mouth at this age from not being there. Okay. So hence an X-ray
is necessary
to see what's blocking.
Okay. That's okay.
Before we do the surgical exposure of the teeth.
Okay.
Sometimes you actually literally have to expose the gum here and a bit more to allow them to freely come down. But apart from that, you seen this?
Actually, now I realize it after nimetuma hizo picha.
Yes.
I think I thought it was normal.
Yes.
What is that?
This is what we call a frenum. It's just fibrous tissue. Okay. Fibrous tissue. However, when it's too low like this, ideally this frenum should be up here. All right?
True.
Sometimes when it's too low like that, it can cause a huge gap between the two.
Right? Between the gap.
So then we do what is called frenectomy. Frenectomy.
So that's the only thing it can cause, the tooth gap, nothing else?
The gap. Yeah.
Okay.
So that flaring of the two front teeth. Okay. Yeah, and then sometimes with time, you find people wanting to come in for braces. to close the gap because sometimes it's unnaturally wide.
Oh.
Okay, so you find people wanting to close it. Yeah,
makes a lot of
you
sense.
can actually do frenectomy, which is just cutting that frenum, okay, and releasing it from here.
Okay.
So today we will do surgical exposure, these two, to allow them to come out, and then we will also do a frenectomy.
Okay, today still,
because we are injecting same place.
Yeah.
All right. Yes.
Okay.
Open wide.
I have another question, Doc, before I forget. So now, we were thinking that it's because of this delay that these teeth are now misbehaving. You see, hazitoki mali zinafaa kutoka. So once we open and release, will that correct this, or will we need to?
What happens? You'll find teeth come out at certain ages. So if you're looking at this upper central, you're looking at the age of from 7 to 8 years. Normally, some children are early bloomers. Even by the age of 6, 7, they will have the uppers. Oh, that's a watermark. So
By flared, you mean?
Flared, not straight. Toka sideways hivi.
Sideways.
Hivi. Badala ya hivi, zitakuwa zinatoka hivi. But it's okay.
With her dental formula?
No. We actually, what we do is monitor. Okay? So we expect this to be in the mouth around about 8 to 9 years. 8 to 9 years.
Oh.
Because the upper canine, erupts at the age of around 12, 13. Okay? Yeah, so then we don't worry so much. Yeah, because they're early bloomers, kawa bloomers, and late bloomers.
Oh, okay. So I think Kenya unaniambia ni ugetu ilikuwa the fact that we can see it here doesn't mean ilikuwa itoke hapa. It's still descending.
It's still descending.
Oh, I think that was our main concern. We thought now that we can see it there, it's coming out from there.
No.
Okay.
Yeah.
I can breathe.
You can breathe now. Yeah. So we don't have to worry too much. You only worry when now we are beyond a certain age.
Okay.
Yes.
So, Doc, now, like, what can we tell parents? Because, like, for us, that was a mistake that if we knew something, we could have corrected and prevented.
Yes.
So, what is your best advice to parents watching this?
My best advice really is one, we always say, as soon as the child gets the first teeth, it is good to bring them to the dentist. So, that's what age? 6 months. 6 months. Yeah.
Do you ever do that?
No, friends don't do that. Yeah. If you delay too much, 2 years, 2.5, they already have all the milk teeth. All right. So you want to bring them in. All right. Because that first visit not only relieves anxiety, first visit for the child, get used to the chair, see what a dental clinic looks like. The subsequent visits for the child are less anxious. Okay? But also the first visit for the child, the parent learns a lot. Okay? So you ask questions.
Yeah.
Okay? We also check how the teeth are developing. Alright? Remember, the teeth have only been in the mouth for 2 years. 2 years, 2.5. But sometimes you do find like children come in as 2.5 and they already have cavities. Yes. So that for 6 months it's good. Come in. Let's play with the dental chair. Let's get used to the dentist. How about we talk about brushing and how you should do, and then make it an annual visit. Just the same way you go for your medical checkups yearly. The same way for your teeth has to be done yearly.
Yeah, we forget our teeth so much.
Yes. A lot of people come in when there's pain, although when there seems to be a problem. But if you came in yearly, just for checkup.
Okay.
Yeah, you'd have found out, or the dentist would have told you, these teeth are not erupting as they should. How about you come in at 6 months, we check. Yeah.
True.
Or there's a cavity forming. How about you do a filling? Yeah. Instead of waiting until the child is in pain. Yeah. Yes. So what I'd advise parents is come in early. As soon as they have their teeth, bring them in.
Okay.
Yeah. Then make it an annual thing to come in. Yeah?
Okay.
And not only for children, even adults.
Even adults.
Most adults wait until they have lots of pain.
And Panado is not working anymore.
Panado is not working, they have not slept.
Thank you.
Yeah. But this is not very common, but it does occur, delay in eruption. Okay? Delay in eruption is caused by, sometimes you have a cyst. A cyst is a sac. Yeah, that forms. Okay? So if it persists, it may block a tooth from erupting. So that can happen, front tooth, back tooth. Yeah. Yes. Can happen in children, especially for the front teeth, or the back teeth adults.
Wow. Okay, well, Mimi, this is the very first time I've heard of it with my own daughter.
Yeah.
I've never heard of it.
Of
a cyst. Yeah.
Yes.
Wow. Okay.
So
thank you for that.
It does occur. Yeah.
But we should also prevent having this tooth removed early. We have to wait for it to shake like a lot, and preferably have it done by the dentist. Although we went to the hospital, by the way.
Yes. What it is, let teeth come out at the right time. There is a tendency for parents to say, "Ini jina utoto, wacha tungo."
I did that.
But the milk teeth have a purpose. Yes.
Which purpose?
One, of course, for children.
Yeah.
You see, when the child has the weaning. Yes. So it means when you have teeth in your mouth, we are ready to eat. Right? So of course, eating is one of those. Secondly, growth of the jaw.
Okay.
If there are no teeth in this jaw, the jaw will not be stimulated to grow as it should. Okay.
Sorry?
They act as a guide for the permanent teeth.
Okay, yeah.
So if you remove them too early, you have no guide for the permanent teeth. Yeah?
And you ruin your dental formula, maybe.
You have no proper growth of the jaw. So then you have a smaller jaw. Your permanent teeth are bigger. When they come out, there is crowding. So they don't have space.
There's a lot of that nowadays.
Yes. So how about we preserve our milk teeth until the right time? If they have cavities, fill them. Unless it's indicated for them to be removed, let us not just be quick to remove milk teeth because we have a replacement. They have a purpose. Yes.
Okay.
Have a purpose.
We never think about that.
Growth of the jaw. Okay. Guiding your permanent
teeth.
Yes. Reserving the space for the permanent tooth. Alright? If you remove it too early, the spaces close. So when your permanent teeth come up, haina space.
Wow.
Yes. Alright? Yeah, so we need to preserve our milk teeth as much
as possible. Wow. Yes. Thank you for that class. What's my school fees, sasa? What are my school fees?
Yes. But also for adults, yeah, let's not be quick to remove our teeth.
Yeah.
Yes, because when you hit a certain age, you will realize you needed those teeth you are removing when you're young. One, if you remove your back teeth, your cheek collapses in.
Oh wow, you start having this shape.
Yeah.
Aki, let me tell you. Doc, I think I'm going to book an appointment. We come and do like a comprehensive video on things, oral health, cause I don't know why it's not something most people talk about. I'm a nimekwanga ignorant.
No, generally.
Cause who thinks about preserving their teeth and wasikwaving?
People preserve the front ones.
Because of the smile.
But you forget you chew with your back ones mainly. Okay? So chewing githeri will be compromised. Yeah? And your teeth act as a support for your cheek to give you a nice facial.
Nice shape.
Yes. So if you moa the molars, they will sink.
Wow.
Okay? They will sink.
So, Botox. Botox will not even help.
And it's more expensive to come in for replacement.
Because I'm actually thinking, even this procedure, I would have saved a lot of money should you have started the dental clinics early.
Yes. If you start the dental clinic early, actually it's cheaper.
Yeah.
People look at it like, why should I go to a dentist every year to be told nothing?
Let me just
There's
eat
a
pizza.
lot to be told. Yes. You know?
True.
So usually people will come in when they're desperate. I want to save this tooth. And when you look at the tooth, it can't be saved. You know? Or if I can save it, it becomes more costly for you.
True.
Yes.
Wow.
Yeah.
Lack of awareness, I think.
Lack of awareness. Serious lack. Serious lack.
Thank
Especially,
you.
I think, in our society where people have other priorities, you know, not by their own making. You know, people look for food, shelter, clothing. But, like you said, health is a priority.
Yeah, true.
Yeah. Ignore. All right? But then this is the right stage to actually restore that tooth. You don't cut out a lot of the tooth. You know? You're able to do a good filling, and you should be able to last until the tooth can
come out.
Yeah. If we leave that cavity without filling it, the hole will go deeper, go to where the nerves are, and you end up doing a root canal for baby teeth.
Okay.
Which is more costly than a normal healing.
An unnecessary trauma.
Exactly.
Oh, okay. Thank you.
Yeah. So annual checkup will capture such stuff.
Okay.
Yes.
We'll be doing that.
Yeah. All right. So I think we are ready for it.
Yes, we are.
Something wrong now that's true.
Yes.
It's also fun.
Yeah. Number one,
Just
checking the teeth. Number two was taking the
Mommy.
Yes, Mama.
Mom. Yeah.
Yeah.
As you can see, she's being prepped for an x-ray. At this point, we had to leave the room because, you know, it's not good to have exposure to the radiation. And the special attire that she's wearing, and also the doctor, is made from lead. And lead actually does not allow radiation to get through. That thing on the neck, the doctor insisted it's very important, especially when it comes to kids, because it protects the thyroid from getting the rays from the x-ray. Then we were ready for the procedure.
Father, you should know I've been going solo. Want my love, baby, earn it. Yeah, dancing on my own. See if you can follow. Got me feeling alive. Watch me go, lose control. Is this real? All I feel. Break the signs. Every time, let's be real, be real, be real. I do what I want. Ooh, I do what I want. Ooh, I do what I want. Ooh, I do what I want. I want. Hear me now, I do what I want. Are you ready now? 'Cause it won't be easy. Only get what you want.
Remember, at this point, when she was cutting through the skin, a lot of water came out, and that was basically the cyst. So after the water came out, there was more room, and you are going to see in the next videos that actually now my baby's teeth are out. Actually, you can see that in the screen at some point.
Gotta go all out. Whenever you see me, don't be wasting my time. Watch me go, lose control. Is this real?
Ladies and gentlemen, and just like that, the oromaxillofacial helped restore my daughter's smile back. I highly recommend this particular oromaxillofacial surgeon. She was so friendly. She made Megan feel so comfortable. She was ready to answer all our concerns, all our questions, and I highly recommend her. She's called Dr. Esther Adede. And then these are the services that are offered.
Father, you should know I've been going solo. Want my love, baby, earn it. Yeah, dancing on my own. See if you can follow. Got me feeling alive.